the hospital's operational backbone. Furthermore, negotiating the fourth industrial revolution has the added complexity for healthcare that, in reality, it's still really in the throes of trying to fully master the technologies and innovations of the old or previous era, and is now going to be required to also rise to the challenge of simultaneously innovating in the new. And as an aside, I would really point out here that speed really is of the essence. I would point out that health as a sector is somewhat late to the party. Digitization and automation of the hospital's end-to-end processes and operation is the basic core capability or prerequisite for a hospital to even be ready to play in this new technological era. We call this core or basic capability that's needed to participate in the new digital era the operational backbone of the hospital. So in the UK, this was very much the culmination of the journey the sector began back in the early 2000s, as hospitals began en masse to start adopting electronic health record and supplementary clinical specialty IT solutions in earnest. These initial implementations to deploy EHRs should ideally all by now be complete. However, I'm aware there still remains a small number of outliers or locations, namely hospitals, where this may not be altogether the case. And for this reason, the health CIO or CDO must now do everything they can to try to catch up as quickly as possible in order to be in a position to satisfactorily meet and support the demand, including architecturally, from the perspectives of their enterprises, for this next wave of digital and technological change. To do this effectively in locations where they are late in completing these initial projects or deployments, the health CIO, CDO will need to take the initiative, take ownership of and remediate the gaps in organizational knowledge, especially at the C or board level, due to some of the new strategic risks posed by some of the new technologies and the current lack of legislative direction around use of a number of them. The health CIO, CDO will need to manage this as part of their future digital strategy and ongoing oversight, and support the organization or hospital accordingly, including through tailored engagement plans that support organization-wide enhanced digital education and literacy to manage innovations in the new technologies across the gaps in staff knowledge.